Cold and flu season is here, as well as a slight rise in the reported cases of COVID. So how do you tell if it's COVID versus the flu or just a really bad cold? News 19's Roger Staffaroni spoke with some local health experts.
What we want people to be is not afraid, but just be prepared and know what to do. If you're sick, you stay home and take care of yourself to prevent the sharing of the germs with other people.
And the germs are out there. Coming off the recent holiday travel and gatherings, COVID, flu, and RSV are here and cases are up.
I think at the end of the day, it doesn't really matter which is which because a virus or infection is still an infection.
It begins with symptoms and taking those first steps to identify what you might have contracted.
Congestion, sore throat, headache, full body aches, fever. If you have any one of these symptoms, it's best just to go get a test because unfortunately, like I said, influenza can look very much just like it. RSV is also hitting people hard and can mirror some of those symptoms. And so the only way you're going to truly know is via testing.
Well, I think when you have respiratory illnesses, you might have a fever, you might have a cough, you might have a runny nose, and it could be any one of those things that we mentioned.
If it's COVID, recovery is a 5-day plan.
So stay home and isolate for 5 days, and then after that 5 days, wear a mask out in public for an additional 5.
And the road to recovery is also paved with a common sense prescription.
The basic thing is stay home if you're sick, take care of yourself, rest, drink lots of fluids like you would normally do and like you did in the past. Take care of yourself.
In La Crosse, Roger Staffaroni, WXOW News 19.
And you can still get a free COVID test through the Wisconsin Department of Health Services, or you can buy a test for $20 at Walgreens. You can also pay your health provider to administer that test.